I never imagined a simple checkup would lead to a sentence that would change my life. The doctor sat me down, placed the scan on the desk, and spoke calmly, too calmly. "Harold, your coronary arteries are 90% blocked. That means your heart is working overtime. And it's running out of options." I looked at him, confused. I wasn't in pain. I didn't feel weak. Sure, I got tired more easily. But I could still walk Duke around the block. Still make my breakfast. Still tease my daughter over the phone. But inside my chest, the truth was harder than it felt. The blood couldn't flow. The vessels were closing. I was standing on the edge of something I couldn't see, but it was there, waiting. The doctor gave me two choices. Wait, and gamble on a heart attack. Or undergo open heart surgery, a procedure that began back in 1967. A cardiac bypass surgery. He explained how it worked. A vein from the leg is sewn around the blockage. A detour for the blood. A bridge to life. It all sounded too much. I'm 76. I've seen wars, lost friends. Buried people I love. But this? This was different. This was me. I hesitated. Then he told me the story of a man I'd never heard of before, Dr. René Favaloro. An Argentine doctor. A pioneer. A man who believed that blocked arteries didn't have to be a death sentence. Dr. René Favaloro was born in 1922 in La Plata, Argentina, and graduated top of his class from the National University of La Plata in 1949. After 5 years building a rural practice back home, he earned a fellowship at the Cleveland Clinic in 1962, where he developed and performed the world's first successful coronary bypass in 1967. He returned to Argentina to found a charitable heart institute, insisting that medicine is a moral act, a philosophy that still saves millions of lives today. And somehow, that story, his story, gave me something I didn't expect: hope. This video isn't just about surgery. It's about second chances. And the quiet hero who saved hearts, millions of them, with one bold idea. Stay with me. Let's walk this road together. Before I said yes to the surgery, I needed to understand the man behind it. Dr. René Favaloro wasn't a famous surgeon in New York. He didn't train at Harvard. He wasn't even American. He was a young doctor from Argentina, working in a small town where the roads were mostly dust and gravel. But he believed something radical. That blocked coronary arteries didn't have to mean death. That instead of waiting for the heart to fail, we could help it beat stronger, longer. In the 1960s, heart disease was a silent killer. Coronary artery disease would close the vessels, and most patients had no warning until it was too late. There were no statins. No stents. And certainly, no bypass surgery for seniors, because the idea didn't exist yet. So in 1962, Favaloro left Argentina. He packed up everything and traveled to the United States, to the Cleveland Clinic, with a dream in his chest and nothing in his hands. At Cleveland, he noticed something strange. Every day, patients with chest pain and clogged arteries came through the doors. And every day, they were sent home with pills and prayers. No one dared to operate. Because of opening the chest. Touching the heart. It was considered madness. But Favaloro couldn't accept that. He studied. Observed. Drew diagrams. Reread anatomy textbooks. And he had one simple idea. What if we could build a bridge around the blockage? He proposed taking a vein from the leg, usually the saphenous vein, and sewing it onto the heart to reroute blood flow. A new path. A detour. A second chance. In 1967, after months of hesitation, he finally convinced a team to let him try. One patient. One heart. One chance. And it worked. The world changed that day. Cardiac bypass surgery became a reality. Suddenly, thousands, then millions, of people could avoid a fatal heart attack. And the man behind it? He didn't ask for money. Or fame. He just returned to Argentina, built a humble clinic, and kept teaching. He wrote, "Medicine is not a business. It is a moral act." And I believe him. Because if it weren't for that act, I might not be here today, telling you this story. I thought the surgery would be the hard part. But no one told me about what comes after. When I opened my eyes, everything was blurred. There were tubes in my mouth, needles in my arms, and machines beeping in the dark. I tried to move, but even breathing felt like drowning. I was in the ICU. The heart surgery was done. The cardiac bypass had worked. But my body, my old, tired body, was trying to remember how to be alive again. Each hour felt like a mountain. I couldn't sit up on my own. I couldn't eat solid food. And my chest burned like it was on fire. They told me, "This is normal. You're healing." But it didn't feel like healing. It felt like breaking into 1,000 pieces, and starting over. I remember one night, maybe day 3. The nurse changed my 4, and I whispered, "Will I ever feel normal again?" She looked at me and said, "Not the same normal. But a new one. A better one, if you walk toward it." And that's when it hit me. Recovery wasn't something they gave me. It was something I had to earn. Step by shaky step. The next morning, they helped me sit up. It took 3 people. My legs trembled. My gown stuck to my back. I took my first 2 steps with tears in my eyes. Not from pain. From disbelief. That, after everything, this heart still beats. Not like before. But still mine. Still alive. And somewhere, in that sterile room filled with wires and alarms, I whispered, "Thank you, Dr. Favaloro." For years, I thought rest was the key to healing. After my bypass surgery, I planned to sleep, take my pills, and wait. But weeks passed, and I wasn't getting stronger. I was more tired. More anxious. And the silence in my living room felt louder than the machines in the ICU. Then, during a follow-up visit, I met Dr. Coronary, a cardiologist with over 30 years of experience. She looked at my chart. Then she looked at me and said, "Harold, pills can't rebuild your heart. Movement does. What you need is called cardiac rehab, starting with walking." At first, I laughed. Walk? With this chest? These legs? But she showed me a study from the American Heart Association. Patients who begin structured walking within 10 days of bypass surgery reduce the risk of readmission by 35%. And improve heart rhythm and blood pressure within 4 weeks. That changed everything. She printed out a 30-day walking protocol, nothing fancy. Just small steps. Increasing each week. I taped it to my fridge. And the next morning, I walked 10 steps to the front door. 12 the next day. I used a pencil to track it all, and suddenly, I felt alive again. By week 3, I wasn't walking to heal, I was walking because it gave me back my identity. Now, I share the same walking log PDF with others. The link's in the description. And if you need motivation, I host a free group. Strong Hearts with Harold. No one sells anything. We just walk. Together. Don't wait to feel ready. You move, and the strength will follow. It wasn't Everest. Just a small hill behind my daughter's house. But to me, it was the place I almost didn't return from. 6 months earlier, I had walked halfway up that slope. Barely. My chest tightened. My knees gave in. I clutched a mailbox and prayed no one saw me fall. That moment led me to the hospital. To the scans. To the truth, my heart was failing. And yet here I was again. This time, not alone. My grandson Ethan, 6 years old and made of sunlight, grabbed my hand and said, "Grandpa, let's go to the top. I'll help you." I wanted to tell him no. To say I was still tired. Still fragile. But instead, I smiled. And I said, "Let's try." We didn't rush. He bounced. I breathed. He laughed. I listened to the sound of my steps. And the steady, beautiful heartbeat that used to betray me. Halfway up, the memory came rushing back. The pain. The fear. The shame of feeling weak in front of strangers. But this time, I didn't stop. Because I remembered the promise I made in that ICU bed. That if I got another chance, I wouldn't waste it. And step by step, I kept that promise. At the top, Ethan stretched his arms like he'd conquered a mountain. I didn't cry, but my chest ached in a new way. Not from strain. From something gentler, like gratitude. I looked down at where I once stumbled. And I looked at him, this little boy who would never know how close he came to losing his grandpa. Then I looked up. The sky is wide open. Air is sharp and full of life. And I whispered, "Thank you, Dr. Favaloro. Because of you, I get to see the world from the top again." When I tell people I'm walking again after bypass surgery, they smile. But most of them don't know what it took to lace up those shoes. It wasn't just the healing of stitches. It was the healing of fear. Of doubt. Of wondering whether my life would ever feel mine again. I don't have all the answers. I'm not a doctor. But I've walked the road. And now, I've built a small path, so you don't have to walk it alone. In the video description, you'll find a link to download the 30-day walking recovery log. The same one I used. Simple. Printable. Forgiving. Because not every day will be perfect. But every step still counts. You'll also find an invite to our free community. Strong Hearts with Harold. It's not a Facebook group full of noise. It's just a quiet corner where people share their wins, their setbacks, and their daily walks. No judgment. No rush. Just gentle reminders that you're not alone. And if this video moved something in you, if it made you pause, or cry, or whisper, maybe it's time, then don't let the moment pass. Drop a comment. Tell me where you're walking today. Or tag someone who might need a second chance. Because healing isn't something we keep. It's something we pass on. And if Dr. Favaloro passed his gift to me, I want to pass it to you. If I could write a letter to the man I was before all this. The man gripping his chest. Too proud to ask for help. Too scared to face the truth. I'd only say one thing. You don't have to be strong all the time. You just have to be honest. And brave enough to take the first step. Because what saved me wasn't surgery. It wasn't the pills. It was the moment I stopped pretending I was fine. It was the moment I listened. To the doctor. To the research. To my body. And maybe, to something bigger than all of that. Now, if you're listening to this, maybe sitting in a quiet kitchen, or walking your first block since leaving the hospital, I want you to know something. Your story is not over. Not even close. Your scars don't make you broken. They make you real. Your steps, even the shaky ones, are evidence of hope. Dr. Favaloro never met me. But he gave me the tool to meet myself again. And that's the real gift. Not just to live longer, but to live deeper. So here's my final wish. May your heart beat long. May your legs carry you far. And may you always remember. Every second chance begins with one small yes.